is something so tiny yet so deadly. And it freaks me out to think that my life can be taken at any given time, at any moment. As I'm sure you guys probably have that same fear. And you're probably wondering, what am I talking about? I'm talking about blood clots. There are some questions that I'd like to answer that you may have regarding blood clots, such as, what is a blood clot? What are the symptoms of a blood clot? What are the dangers of a blood clot? And what can I do to prevent a blood clot from happening to me? Well, first of all, let me tell you a little bit about exactly what a blood clot is. A blood clot is a gel-like structure that is made up of fibrin, red blood cells, and platelets. Now, it's normal for us to get blood clots, right? Say we cut our finger while we're cutting up celery for dinner, or we're out playing with our kids and we fall and scrape our knee. Blood will form a semi-solid gel-like structure, which is the blood clot, and that will rush to the scene of the crime to create a plug, and that plug will stop any more blood flow from coming out through that broken blood vessel, which is good. We want that. We don't want to bleed out, right? And then that gel-like structure that went and plugged that open vessel will then become a scab. Those annoying, hard, itchy, annoying things that we will get on our skin, and we want to pick them, but we shouldn't. Don't pick them. But then there are also blood clots that form that are abnormal, and they develop for no good reason at all. And these are blood clots that will develop in your vessels. Your vessels are your veins and your arteries. Now, a lot of blood clots will form in your leg. They can really form anywhere in your body, but a lot of them do form in your leg, and those are called deep vein thrombosis. And a thrombosis is when the blood clot sticks to the inside of your vessel. When it becomes really dangerous is when that blood clot breaks away from the wall of the vessel and is free floating through one of your vessels. And the reason why that's so dangerous is because if that blood clot flows, it will go up through your body or down through your body, and it can attack vital organs such as your heart, your lungs, and your brain. And why is that dangerous? That's dangerous because it can restrict blood flow to getting to those vital organs. And if we don't get a good enough blood flow, we're not getting the oxygen, we're not getting the nutrients that those vital organs need for us to continue living. And that's obviously bad. And that can cause, blood clots can cause stroke, it can cause a heart attack, and it can cause a pulmonary embolism. And none of those things are good. So what can you look out for? How do you know if you have a blood clot? What can you do to prevent it? One of the things that you can really look for is, for example, if you have a blood clot in your brain, you will have difficulty speaking, vision problem. You may have some weakness and tenderness up in your upper body. You may even have a severe headache. Those are signs that you should go to the doctor. Blood clots can also form in your abdomen, which would cause severe pain in your abdomen and possibly vomiting blood and diarrhea. If you have them in your arms, your legs, you'd notice swelling, redness. It would be tender to the touch, and it could also feel warm to the touch. If you have it in your lungs, which is extremely painful, you have shortness of breath. It feels like someone's taken a knife and jabbed it in between your ribs and it's twisting. You can have discomfort all over. You can be coughing violently. You can be coughing violently with blood coming up. Now, with all of these, not all people experience the same types of symptoms. Sometimes you might not have any symptoms at all. And And that's what can be scary. So a way that you can prevent this from happening to you is you can find out your family history, first of all. If you're not able to find out your family history, you can go to your doctors and get a simple blood test done to see if you have a blood clotting disorder. Um, and that will help to determine what you should do from there. Other things to consider it or to consider is if you're pregnant, if you travel long distances, or you're sitting for long hours at work, or you're studying for long hours and you're sitting, get up, walk around, move, get that blood flowing. That will help. Um, Also, another thing is when you have surgery, that can cause blood clots. And obviously, if you have surgery, you've probably heard the runaround from the doctor about complications of surgery, and blood clots is one of them. There's a whole slew of things that we could talk about blood clots, but if you do feel that you have any abnormal experiences, symptoms within your body, you know what doesn't feel right. So if something doesn't feel right, go to the doctors, go to the ER just to be on the safe side because it could save your life. Now, it's time for me to wrap up this speech. Again, blood clots, extremely dangerous, can hit you at any time. Um, it can affect anybody at any time, any age, um, doesn't discriminate at all. So take care of yourself and be healthy, and hopefully you will never experience a blood clot. And if you do, or if somebody you love does, you will know what to do in order to help them. Thank you.